Like a raindrop creates a ripple effect in the water, the spread of COVID-19 has shed light on the many issues plaguing our modern healthcare system. This highly infectious disease caused by SARS-CoV-2 was declared a pandemic by the World Health Organization on March 11, 2020, affecting 188 countries and territories worldwide. Specifically in the United States, over 2 million people have been affected, among which current data from the CDC indicates that a disproportionate amount of illness and death affect racial and ethnic minority groups. In a recent CDC report of 580 patients hospitalized with COVID-19, 45% of those hospitalized were white, compared to 59% in the community, and 33% were Black, compared to 18% in the community, suggesting an overrepresentation of minorities among hospitalized patients. In Michigan and Illinois, Black people make up 14% of the state's population, yet they account for more than 30% of coronavirus deaths. In New York City, death rates for Blacks and Latinx are significantly higher as well. Structural racism within the United States contributes to poor economic and social conditions, leaving many minority groups vulnerable to public health emergencies. Because of a history of housing discrimination and redlining, many individuals are more likely to live in densely populated areas that lack access to resources like grocery stores and medical facilities. Since the virus is easily spread through close contact, it's more difficult to protect and isolate individuals within these areas. Minorities are also more likely to have poorer underlying health and have little to no access to healthcare resources. About 89.3% of patients who contracted the virus had some sort of underlying health condition. Since minorities are more likely to be diagnosed with chronic health conditions like diabetes and high blood pressure, they're also more vulnerable to contracting COVID-19. Additionally, according to the CDC, compared to whites, Latinx are almost 3 times as likely to be uninsured, and Black individuals are almost twice as likely to be uninsured. Due to the lack of coronavirus testing, doctors usually refer patients for testing. However, minorities are less likely to have a primary care physician, or may be less likely referred for testing due to implicit bias. This deep-rooted history of systemic racism within America has unfortunately magnified the health disparities of COVID-19. Change must be enacted to disrupt this imbalance of equity in healthcare, and it all starts with communities working together to educate, provide services, be actively anti-racist, and promote trust by breaking the barriers that restrict proper healthcare.